Hello, I'm Dr. Jake, and welcome to your doctor's report. This is by far your most important visit here at Revive, and also our favorite. What we will cover here in the next 25 minutes will prepare you to know exactly what you're looking at on your own personal results. And with this knowledge, you will have all the right information to make the best decision with your own health today. Most Americans know that they should eat healthy and exercise, and even how to do those well. But unfortunately, many know very little about the condition of their own spine and much less on how to care for their spine. But this will not be the case for you. After this educational video, you and the doctor will figure out the best plan for you moving forward. It is our mission to help you and our community here in the Twin Cities with this life-changing information. With that being said, would you say that America or even the Twin Cities is getting healthier or sicker as the years go by? Yeah, absolutely. No doctor in the world will deny that sickness and disease continue to rise and that the overall health continues to decline. Now, despite all the resources and the information we have at our fingertips, this is a big problem. For example, look at heart disease and strokes. They kill over 850,000 Americans every year, and cancer, 600,000. And diseases like diabetes, obesity, autoimmune diseases are skyrocketing. And why do you think this is? Many people used to just think that it was their genetics or it was just running in their family, and they had no control over these. Thankfully, science continues to prove this incorrect. This massive problem may sometimes feel way too big to even apply to us individually. But this is very personal. How many of you know one or even two loved ones who are suffering with a chronic disease or have in the past? Statistically, most of us. And maybe even you yourself are struggling with the disease today. But the science has been out for years. Genetics only has a 10% role in most chronic diseases, whereas the other 90% has to do with our lifestyles. Now, the good news in this, who is in control of our lifestyles? Yes, exactly, we are. Now, this should be empowering for all of us. With the right information and the right steps, we can take and change the trajectory of our own health and lives back. But we have to change the way we are doing things. When do most people start taking care of themselves? Yes, after there's a problem. Now, what's the first thing we normally do? Yep, ignore it. Saying, I don't have time for this, or I'll deal with it later. And if it continues, we take an over-the-counter medication, or then we go to see the doctor, and he gives us what? Yep, medications. And then if it gets worse, then we go see a specialist who gives us more powerful medications, or even a surgeon. Now, don't get me wrong. There's a time and place for it, and we have the best emergency care in the world. And if I get in a severe car accident, I thank God that I have the surgeons and the medications to help me heal. But it's a problem when we use those for wellness. And this needs to change, and people have been changing. Even maybe you have changed, because our bodies are amazing and they were designed to be healthy. From the day we were born to the day we die, our bodies were designed to heal. When a beautiful baby is born and it scratches its cute little face, we don't have to teach it to heal, do we? No, this is called innate or inborn intelligence. This innate intelligence is what tells our body how to heal and how to function every single second of our day and our lives. Now, from our hearts beating to our lungs breathing, stomach digesting food, or even for a cut on our hand to heal, or for you to hear and see me right now, your body is doing this. It's amazing. Now, this is all possible because your nervous system, your brain, it literally controls every function in your body. It's the master control system, and it does this by communicating down your spinal cord and out through the nerves to literally every cell, tissue, and organ in your body. And if this system controls everything, would you agree that it is the most important system in the body? And we should know what's going on with it. And that is why God designed our bodies with a skull, or a helmet to fully protect our brain, which, by the way, is the only organ fully protected by bone in our body, and for good reason. And from there, we have our spine. Now, this was made to protect our spinal cord and our nerves like a suit of armor. Our spine should be straight from front to back, but we should have 3 vital curvatures from the side, one in our neck, mid-back, and lower back. Unfortunately, life is stressful. Thanks, Captain Obvious, right? But in all reality, right, many of us don't realize the effect stress is having on our bodies and our health until it's way too late. Modern life today is very stressful in 3 main ways: our thoughts, the toxins around us, and then also traumas. Now, our thoughts and mental health can wreak havoc on our physical bodies. Just ask somebody struggling with anxiety or depression, right? These two conditions alone continue to be more and more prevalent and more severe every year. Now, the next is toxins. Just think about the chemicals we are bombarded with daily, from our processed foods to chemicals at work, to plastics around our world, skin, hair products, right? These toxins have a huge and growing negative effect on our physical bodies. Last but definitely not least, traumas, both micro and macro, right? Of course, many of us have had big falls, accidents, sports injuries, car accidents over the years, which do affect our health. But it is sometimes the micro or small repetitive traumas that have a greater impact on our health. And when it comes to microtraumas, think about the hours upon hours of technology, or sitting, or lifting our children, or yard work, or cleaning, you fill in the blank, right? These repetitive, stressful activities can cause microtraumas leading to injuries, damage, disease in your body, and especially disease in your spine. This damage in the spine is called a subluxation. Any shift out of normal posture or a position in your spine is what a subluxation is. This is one of the most significant health problems plaguing human beings today. Any shift, damage, or inflammation in the spine causes a direct or indirect decrease in the body's ability to heal and function. Now, when the body does not heal or function correctly, what do you get? Yes, injury, sickness, disease, damage, pain, symptoms, right? Now, you may be here because you have heard of someone's testimony after getting chiropractic care, right? When people correct their subluxations and spinal posture, they can experience the traditional known benefits of chiropractic, like eliminated neck pain and back pain and headaches. But most people are shocked to hear that chiropractic care helped their bodies heal from things like acid reflux and digestive issues and sleep problems, depression and fertility, right? The list goes on. And this is not a surprise once we understand the connection between our brain, our spine, and literally every other organ in our body. And this is what we are so passionate about here at Revive. Most people don't come here just to get out of pain. Humans will put up with a surprising amount of pain. We are stubborn. and most people seek change when their pain or problem is affecting many things, and many things that they can't do anymore, like they want to do or that they need to do. Or in other words, they're motivated when their health is affecting their hobbies, their work, their relationships, or their parenting. And Revive Chiropractic and Wellness exists to help people just like you get your life back, or to continue doing the things you love to do for the rest of your life. That is true health. That is freedom. And this is why most of you are here. The way to do this is not by covering up your symptoms and your problems, but by correcting the cause of your problems. Now, in order to fix the cause, we need to find the cause. And this is where your exam testing you received on your first visit comes into play. Your posture, your range of motion, your x-rays, bilateral weight scales, they're vital for finding subluxation in your spine and determining what's causing your problem. And for those of you who are pregnant or too young to get x-rays, we use surface EMG nerve scans to determine where you have subluxation in your spine due to the thoughts, traumas, and toxins in your life. Now, if we find subluxation and the cause to your health problems, we will be recommending a corrective care plan for you. Now, for almost everyone, this is a 4 to 5 month plan. We call this your initial intensive care plan. Although the length of time may be the same or similar for a lot of people, the recommendations and protocols will be different depending on the severity of your problem and subluxation. Our recommendations will be based on 2 things. 1, what are your goals? 2, your exam findings. And then those recommendations will be in 3 main categories. For you to get better results faster, we will discuss 1, your adjustment rhythm, or how often you should be adjusted. Now 2, we want to break bad habits that are hurting us. And 3, you need corrective rehab. Typically, a visit in the office takes 20 to 30 minutes. You will check in, you'll do your neck traction on the wall, you'll do your lumbar wobble rehab in the chair, and then you get adjusted and do your vibration therapy. Now, you will also get your own rehab kit to use at home. And then every 12 visits, you will do a reassessment to track progress and to see how well you're doing with making it to your adjustments, correcting your bad habits, and also doing your home rehab. And at the end of this 4 to 5 months, we will take re-x-rays again and we'll retest to determine if you have hit your goals and what your next steps should be for you. Now, we are not shy to tell you that this plan does require your time, your energy, your intentionality, but the results in our office year after year speak for themselves. It is worth it. Now, because most insurance plans have a high deductible or a high copay or don't even cover wellness care, we remain an out-of-network provider. This allows us to reduce our costs, get you the corrective care that you need at an affordable price. We will show you how we make this possible for single mothers, large families, our retired patients, and even for you. People are finally correcting their problems and free to live the lives that they were designed for. Now, the question we have to answer is, how do you know if you have a subluxation, right? There are a combination of factors that we do have to consider. One, subjective ways. These are what you, the patient, feel and experience on a day-to-day basis. Once again, is pain good or bad? You're right, it's not fun, but it is good because it tells us that something is wrong, like a body signal, a warning sign. Second, objective findings. Things like your posture, bilateral weight scales, what your doctor can feel, nerve scans, tests, and even x-rays. Now, x-rays are such a powerful tool because it can tell us what is going on down to the millimeter. It helps us know with greater precision how to adjust and how to correct your spine. It can let us know how long it has been happening as well, and can show us a problem before the person even has pain or a body signal. And we here at Revive don't want you just to take our word for it. You are intelligent, so we're going to teach you what a healthy x-ray and an unhealthy x-ray looks like. So then in a few minutes when we meet together, right, you meet with your doctor individually, you will know exactly what you're looking at on your own x-rays. All right, this is where the rubber meets the road. I'm going to teach you how to read your own x-rays and also to know the 3 phases of subluxation degeneration. And so if you were daydreaming or you were looking at your phone, please really pay attention now. You will be reading your x-rays back to us. And in order for you to know what is unhealthy, we must first also determine what is normal, what is healthy or ideal when it comes to our x-rays. Now, to teach today, I will start using the neck curvature x-ray here. This is perfect because this curve is known as the arc of life. Because if you have a problem here, it can literally choke off and affect everything else below in your body. For example, if you had to choose, would you rather break your neck or break your lower back? Easy, right? We'd rather break our lower back. And that's because if you break your neck, most people die or don't live long because the brain can no longer tell the major organs, like your heart or your lungs, how to function and heal properly. Kind of a big deal. Now, if we get back to our x-ray here, normal. We should see 3 main things when it comes to a healthy neck. Okay? 1, we want to be able to see a 45-degree curvature. This is vital for the proper flow from the brain to come all the way through to the rest of the body. 2, we want to be able to see healthy head posture. Right? Now, with this one, this vertical line should be touching the spine. And it shows us if we have any forward head posture. We're seeing this more rounded shoulders, hunched forward, hunched back. And we're seeing this, and maybe you've even seen this in other people or even your own pictures. But just think about the technology, the phone, the computers, the amount of sitting that we're doing is pulling us in this direction. And this is a big deal in our culture, and it's getting worse and worse every year due to the technology and our sedentary lifestyles. Now, the reason that this is so unhealthy goes beyond just how we look when we're hunched. Because for every inch or every 25 millimeters that this spine falls forward adds 10 pounds of pressure to the back of your head. Think about over a gallon of milk or a 10-pound dumbbell sitting on the back of your neck. That's a big deal. Now, when we look at the third piece, right, it is your discs. So in between each one of the spinal bones or your vertebra, we should see an open space here. You can see kind of these black lines in between each one of the bones. Now, these are cartilage cushions, and these are called spinal discs. Now, these should be fat, they should be nice and open, and these allow for your spine to be both strong and flexible at the same time. So to recap, the three major things that we need on this x-ray is going to be 1, a 45-degree curvature, 2, normal or healthy head posture, and 3, healthy discs. Now, unfortunately, as we discussed, life is stressful, beginning at the birth process. There is stress for all of us. They say over 80% of babies today have some level of damage to the upper portion of their neck upon their birth. And this is why every child should be checked for subluxation on day 1, their birthday, right? This would then give them the best chance to have a healthy, normal spine their whole life. And that is powerful. Talk about one of the most simple yet profound gifts to give to your children or your grandchildren. This is huge. Think about the amount of pain, the suffering, and the amount of money one could save by taking care of this sooner rather than later. And this is our vision. This is what we hope for. This is what we pray for every one of the kids in our community. And then we step on this, right? It is always better and easier to raise healthy kids than it is to fix broken adults. And that right there speaks for itself. Now, I know that some of you are saying, they're like, well, I'm older than a day old. I have hope for you as well too. But the game changes. If our stressed and damaged spines go uncorrected, we develop spinal subluxation degeneration. And there are 3 phases to this, 3 being the worst. Now, worst does not always mean the most amount of pain, right? But rather how long that the damage has been there. Because we've had patients come in phase 1 and they're excruciating. They can barely even walk into our office. And yet we've had phase 2 and 3 who didn't even know that they had it. No pain whatsoever. Hence why pain can be a good indicator, but should not be our only way to determine and to tell if we are healthy. And this is why we have to determine what phase of subluxation degeneration you are in. And here it is, phase 1, spinal subluxation degeneration. This is what it looks like. Look at the 3 main components again. 1, curvature, healthy or unhealthy. As you can see, very unhealthy. This is very straight. Now, 2, what we want to be able to look at is head posture, healthy or unhealthy. We can see that this has fallen forward 33 millimeters. Now, this is over 1 inch of forward head posture and adding over 10 pounds of pressure to the spine and to the nervous system. Okay? That's a big deal right there. Now, 3rd, are the disc spaces healthy or unhealthy? Yeah, these are still healthy yet. Okay? Now, this is the main difference between phase 1 and phase 2. So here you go. Remember this because I will ask you what phase you're in. Now, these discs do have pressure on them from the loss of curvature and also the forward head posture, but they only have been there for about 1 to 5 years, as you can see here. They're early on in the process, so they're still strong enough to hold up underneath the pressure. But if a person is unaware or does not know that they need to correct this or even chooses not to, what do you think will happen over time? Get better or worse? Yeah, sadly, worse. And here you have it, phase 2. Now, phase 2 subluxation, let's look at this. 1, curvature, healthy or unhealthy? Yeah. Can you see that this is a negative 12-degree curvature? This is going the opposite way that it should be. It's reversed. And 2, healthy or unhealthy forward head posture? Yeah. Can you see that this is 60 millimeters almost? It's over 2 inches of forward head posture. That adds 20 pounds of added pressure to their neck. And here you go. The signature of phase 2 degeneration. Healthy or unhealthy discs? Now, as you go down here, we can see that we have some healthy discs here, and then we have damaged, squashed, and smashed discs right here. Now, these are something that have been developing for a long time, 5 to 15 years. These are probably closer to the 10 to 15 year mark. But you may have heard terms used for this like disc bulges and arthritis, bone spurs, degenerative disc disease, and even slip discs. Now, for many people, this causes stiffness and pain and sometimes very severe pain. But many times there's no pain with this, surprisingly. And this patient right here, her name was Sue. And she came in with no neck pain, no headaches, it was thyroid issues. Okay? Yep. She was 51 and she came in because she had had 25 years worth of thyroid problems up and down. She tried everything without results, medication and supplements and nutrition and exercise. And you can see why. The missing piece for her was right here. right? We know that the thyroid sits right here in the front portion of the neck, and the nerves going to that are right here. And we can see that the brain is disconnected and has interference telling that part of the body how to work properly. And right when she saw this blew her mind, and she was all in from the get-go. Just after 5 months of care, she was able to wean off of her medications, and she had normal thyroid function for the first time in 20 years. Truly amazing to watch her body heal itself. And this right here is the principle that gets people results in our office. Now, we don't cure anything as chiropractors. We help remove the interference like Sue had here and let the body do what God designed it to do, heal. Now, these people in phase 2, they do have permanent damage. There's no sugarcoating that, but they are not a lost cause or too late. Yes, they would not be able to fully undo the damage that they have here, but for the very base minimum, they need to stop the damage and stop it from progressing. And the second piece of their goal is going to be, can we improve by 25, 50, or 75%? Do you think they want to? Yeah, of course, right? This becomes their new goal. And for that same reason, these patients usually refer the most amount of patients to our office. They're telling people all the time to just go get checked because they wish that they would have been able to catch this sooner. Now, it is true that they can't go back in time, but the reason they keep telling people is because if they can help others catch it before they did, they are always happy to help people. Now, that brings us to phase 3. Right? Phase 3 here, this has been building for a long time, 15 to 20 plus years. Some of these people are many, many decades of damage. And let's analyze this here. 1, how is their curvature? Yeah, you might say what curvature, but they have negative and positive. It's a very broken up spine here. 2, how is their head posture? Yeah, we see that very unhealthy. It's 57, almost over 2 inches of forward head posture here. And then 3, discs, how are they doing? Healthy or unhealthy? And we see that this one up top here is doing pretty good. This one has phase 2 degeneration as well as this one. And then these 3 are the phase 3 here. They're fused. These ones are not correctable. Now she has degeneration, arthritis, and fusion. And unfortunately, Judy, as you can see here, this was her right here. She is one of the sweetest and the spunkiest women that I've ever met, and it has been bringing smiles to this office since 2017. This is sad for many reasons, but mainly because I know Judy has seen dozens of doctors over the decades, and not one of them has gotten to the root cause of her problem, only kicking the can down the street. Now, we still have cared for her gladly and happily. And we've helped her maintain her quality of life because she's always says that when she comes in, I know I just need to keep coming to my Revive and you guys will help me be at my best to the end. Now we're all going to die. She says that we're all going to die. It's just a matter of quality of life. And she has seen many, many changes in her spine, far greater than I think any of us even expected. But that right there, she still wishes that she would have never gotten this far. And that's going to be our passion. And that's why I'm glad that you guys are here now to answer these 3 questions for yourself, right? Did you find the cause of your problem? Or we're going to talk about this with your doctor. Or in other words, did you confirm subluxation? 2, did you catch it in time? Or what phase am I in? And then 3, what should I do next? Now, before we go and look at your x-rays, I want to teach you how to read your other x-rays that we went through as well. As you remember, we took an x-ray with your mouth open, and this was to see if your head was level and that your spine was straight from front to back. Also, your mouth was open to get your teeth out of the way. The teeth are typically covering up the top 2 bones in the spine here. These protect the brainstem that sits right in the center here. Now, if these are shifted, your whole body can suffer greatly due to the nerve flow interference right out of the gates, right out of the brain. Now, it's like kinking the hose at the house. A lot less water is going to be coming out of the sprinkler. It's plain and simple. Now, if we look at the lower back here, we got 2 views to look at. This first one on the left, we see that we should have two major things that we want to be able to see: hips And your tailbone should be nice and level, and we want to make sure that your lower back is as straight as possible, right up into your rib cage here. Right? Now, the other one over here, all right, we have the side of your lower back, and what we want to be able to see is you can see your femur bone here, the hip socket, tailbone, and then curvature. Should be a nice, healthy 35-degree curvature, and then also nice, healthy disc spaces, just like your neck. Now, here is a great story about Mark. On this view right here, this is the before picture that you can see. Obviously got his hip socket and his tailbone here, and then his lumbar curvature, or the lack thereof. Now, when he came, he had a -2-degree curvature here. It was reversed. He also had degeneration and some bone spurs that were starting right at this point right here. Now, there was no surprise of why he was struggling with his lower back pain for years. But just look at this, the after picture. This is just 4 months later after his initial intensive care plan. He went from a -2-degree curvature to a whopping 27 degrees. This is huge. This is an awesome change, far greater than we even expected for him to be at this point. But he also gained almost 6 millimeters back in his disc space. So not only did he stop damage from progressing over here, but he was able to reverse it. And this is amazing for us to be able to see. Amazing changes. And as Mark even said too, you can see him here. I'll read his quote in his testimony. He just said, "As a result of my regular adjustments and at-home routine, after struggling with lower back pain and discomfort for years, I am now doing CrossFit 3 times a week and living a fuller and more active life." Truly amazing and fun to see. And this is our heart for you, a fuller and more active life. And now that you are empowered with the right information, it is time for you to meet with your doctor. They will take you back individually to review your exam findings and talk about your next steps towards a healthier future. We are so glad that you're here today and excited to help you revive your health like so many have done before you.